Dear patients, on this example, this treatment example, I would like to explain a few things about how the strategic implant works and how we can do our treatments in immediate loading and without bone augmentation. This is a question that we have to answer very frequently. We get many emails asking us how is it possible that we don't need bone augmentation, whereas all the colleagues which are working with conventional implants, with the two-stage implants, propose to the patients to do bone augmentation prior to implant placement. Well, the trick is that we are using the corticals in the way that traumatologists and orthopedic surgeons are doing it. You see here, for example, in the upper front, the anchorage of three implants on the right side of the patient in the floor of the nose. This is a cortical anchorage. You don't see the cortical in this animation because it's a thin plate and it's not in focus here. Likewise, on the left side of the patient, there are three implants inserted into the floor of the nose. So the implants are actually penetrating from the alveolar bone through this cortical base of the nose into the space, into the airway actually. So some of the implants are going to penetrate into the airway, and so the implants are ending in the nasal mucosa. Remember in the 90s of the last centuries, we were doing similar treatments, but we did this with a nose lift, with an augmentation inside the bone. But we saw in the last 20 years that this nose lift is not necessary as long as we are using thin and polished implants, just as traumatologists are doing this. So these implants are following all the rules of traumatology and orthopedic surgery. And that's the reason also why we work in immediate loading, because also in traumatology and orthopedic surgery, always the surgeon will strive to do the treatment in immediate loading. This is now the view from the back. You see the tubular pterygoid implant on the left side of the patient, on the right side of the patient. These implants are anchored in the pterygoid plate of the sphenoid bone. Um, this is a part of the skull which does not have any teeth or never had any teeth. This bone is there in order to attach muscles, the pterygoid muscles, and that's why this bone is very stable and is also highly mineralized. It's just as mineralized as the floor of the nose, and we can utilize this bone for implant anchorage in combination with this anterior anchorage in the floor of the nose. Many surgeons prefer to put two tubular pterygoid implants into the back of the maxilla, but in this case, this was not done. So we see here a combination of a short implant, which is anchored in the cortical floor of the maxillary sinus, and a long implant, which is anchored in the tubular pterygoid region. So this implant passes through the tuberosity of the maxilla and it anchors in the pterygoid plate of the sphenoid bone. There are more implants anchored between this anterior anchorage and the distal anchorage. So for example, here is a method 11 implant, which is anchored on the palatal side of the maxilla. And likewise here, an implant is probably anchored in the floor of the sinus. So this is a typical treatment in the upper jaw. The picture was taken when the bridge was exchanged, so you see some accessory bars to stabilize the bridge. In the lower jaw, a combination of compression screws and strategic implants are used or have been used. The strategic implant should be in cortical contact, either inside the mandible or on the outside of the mandible. And these compression screws are simply compressing the spongus bone, and they receive stabilization through that. Here you see this combination, strategic implant, compression screw, compression screw, compression screw, strategic implant. So this combination is often used in the mandible. Some doctors prefer to use it also in the upper jaw. I also want to mention that some doctors don't like to put these strategic implant, this type of strategic implant into the tuberosity. They use a combination implant which has three different threads for three different regions and which also gives a lot of stability. All these treatments are done in immediate loading because we are using the cortical anchorage and because we are using enough implants. All these implants are then splinted by the bridge, and it is absolutely necessary to incorporate this bridge within a few days. Usually we do this within 3 days because the splinting, which is given by the bridge, stabilizes the implants, and then they can also integrate in those parts where they are not fixated. This case was obviously treated in the upper jaw with a two-piece bridge, so one piece for the right side, one piece for the left side. So I don't see a combination here, a connection here. So basically, these are two bridges. Most treatment providers would solve this case with a tubular bridge without this separation here in the front. Now on this animation you see the soft tissues also, you see the maxillary sinuses, you see the nose. Now, and you can estimate approximately how these implants are anchored. It looks a bit weird and unplanned, but this is of course a very planned treatment. Every implant has been placed according to one of the methods which have been approved by the IF, and they are all cortically anchored. On this slice, you see a panoramic overview picture. Here, you see these compression screws, combination with the strategic implant, shortened compression screw, shortened because of the nerve. And this is very interesting slide because you see that the implants are integrated and the bone has a high degree of mineralization only in the direction of the cortical. So in the direction of the vestibular cortical, that's the vestibular cortical, and the lingual cortical, and the mineralization is only here. So you don't see any mineralization in the center of the mandible. Even the mineralization is less than at that time when the teeth were there, before the teeth were extracted. So this tells us that osseointegration takes place into the direction of the cortical. I mean, it's clear that cortical anchorage is the best in this case. It also tells us, I mean, this picture tells us that the implant surfaces are not important at all because this is a polished surface and it integrates into the direction of the cortical. And there are cases published in literature very often showing two-stage implants, rough two-stage implants, trauma-necessary surface, and so on. And you see exactly the same picture. So never this surface leads to an osseointegration all around. Always the osseointegration takes place in the direction of the cortical, and this is a fact which is unfortunately very neglected. There are still doctors buying 200, 300, 400 euro implants because of the surface. That's of course not necessary because, as you see, even a polished implant gets a very good osseointegration in the direction of the cortical. So I hope that these few minutes and these videos have enlightened you a little bit, and if there are more questions, please do not hesitate to contact SIMPLADENT, the nearest SIMPLADENT clinic. If you want to find out if the treatment which we can provide with the help of the strategic implant will also be possible in your case, if it can help you, please contact any of the SIMPLADENT clinics mentioned at the end of this video. Thank you very much.